Hello, I'm Matthew Jarron, Museum Curator at the University of Dundee, and welcome to the latest in a series of short films in which I talk about some of the highlights of the University Museum collections. And today I want to return to the Tayside Medical History Museum and focus on 11 notable medical pioneers that are represented through the museum's collections. Now, I hasten to add that these are not meant to be the 11 most important people in the history of medicine in Dundee. They just happen to be the ones that I can talk about through the objects and artworks that we have in the museum. So our first pioneer takes us all the way back to the late 16th and early 17th century, and if you go to the boardroom at Ninemills Hospital, you'll find this painting. This is actually the oldest work of art that we have in the university collections, painted in 1614, and it's of perhaps the first really notable Dundee doctor, David Kinloch. Well, Kinloch was born in Dundee in 1559 and studied in St Andrews before moving to Paris, where he became a distinguished physician, and his patients included members of the French royal family. Returning to Scotland, he was appointed Mediciner to His Majesty James VI in 1596. The king thought so highly of him that he was sent on diplomatic missions to the continent, and while visiting Madrid, he was actually taken prisoner by the Spanish Inquisition. Now, there's an extraordinary story about how he managed to escape their clutches, but I'm not going to tell that now because Erin Farley at Dundee Central Library has actually recently made a video telling that wonderful tall tale, and you can find that on the Leisure and Culture Dundee YouTube channel. Anyway, Kinloch returned to Scotland and went on to publish a number of medical texts in the form of Latin poems, including De Hominis Procreatione, a somewhat racy poem about sexual practice, which actually includes intelligent and practical accounts of fertility, pregnancy, fetal development and delivery. Although we know of 4 medieval hospitals in Dundee, the first proper hospital in the modern sense of the word was the Royal Infirmary, which opened in 1798. And here we have another portrait to represent our next pioneer, John Crichton. Crichton was also born in Dundee in 1772 and was one of the original attending surgeons at the infirmary when it first opened, remaining there for 57 years. He was known as one of the most skilled surgeons of his day, in particular for his speciality of lithotomy to remove stones from the urinary tract. He performed over 200 of these operations with a mortality rate of less than 7%, which was really remarkable in the days before effective anaesthesia and antisepsis. Apparently Crichton himself put his success down to the happiness of a mind that was never ruffled or disconcerted, and a hand that never trembled during any operation. Well, moving on to Victorian times, one of Crichton's successors as surgeon at Dundee Royal Infirmary was David Gregg. Born in 1832, Gregg served as resident surgeon at DRI from 1859 to 1871, and then as consulting surgeon until 1890. Following a distinguished undergraduate career at Edinburgh, his professor sent him and 2 other young surgeons to the Crimean War to show how chloroform should be used. He actually went there on the same ship as Florence Nightingale and served with her at the hospital in Scutari. While there, he had to bury his 2 Edinburgh colleagues who had succumbed to typhus and only narrowly recovered from the same illness himself. He was awarded the Turkish and Crimean medals and wrote a detailed account of his experiences. We have 2 of his original instrument cases, one of which is inscribed with his Crimean dates. By the time Gregg came to work at DRI, it had moved to new and larger premises, though having this graveyard nearby must have been a bit disconcerting for the patients. The improved resources allowed staff to undertake research for the first time, and perhaps the most notable example of this was the work of Thomas McLaggen, who was medical superintendent in the 1860s. During a major fever epidemic, he became one of the first to recognise the clinical value of thermometers, significantly reducing the mortality rate as a result. His most important work, however, was the research he carried out into the anti-rheumatic effects of salicin, a chemical extracted from willow bark. McLaggen's work was taken up by German researchers who used salicin to develop acetyl salicylic acid, better known today as aspirin. And this is the microscope that McLaggen used for his research. He later moved to London and established a fashionable practice whose patients included Thomas Carlyle and members of the royal family. At the time of his death in 1903, it was said that he deserves a niche in the Temple of Fame as one of the great benefactors of the human race. I already mentioned our next pioneer, Rebecca Strong, in my earlier film about Dundee Royal Infirmary. She came to Dundee in 1874, at a time when the physician, Dr. Robert Sinclair, had presented a comprehensive report on the unsatisfactory state of the nursing department at DRI, recommending that a training school for young women of good character and education be established under the control of a qualified and efficient matron. Rebecca Strong was the matron appointed, having come from St Thomas's Hospital in London, where she had been a pupil of Florence Nightingale. Over the next 5 years, she raised the nursing department to a standard that was exceptionally high for the time. She later moved on to Glasgow, where she had more difficulty implementing her reforms, but in 1893 she pioneered the so-called block system of training for nurses, which consisted of short periods of nursing school instruction, followed by periods of practice in the various wards of the local hospital. The system became adopted across Europe, the United States and other countries, making Strong an internationally renowned figure. Now, we don't have any objects specifically associated with her in the collection, but we do have this framed photograph of Florence Nightingale, which came from the nurses' home at DRI, and so it may well be that this was presented by Strong herself. In 1897, Dundee's medical school was formally established, and more active research became possible. William Tulloch was a student at the school who graduated in 1909, and then returned 5 years later as a lecturer in bacteriology. During the Great War, he did important work for the Royal Army Medical Corps, tackling two of their most significant problems: wound infection, notably tetanus, and the outbreaks of cerebrospinal meningitis, which occurred in crowded barracks. In 1921, he became Dundee's first professor of bacteriology, and these are samples that he used in his later research into complement fixation and vaccines. One of Dundee's most celebrated medical pioneers is Margaret Fairley, famous as the first woman to be awarded a chair in a Scottish university when she was appointed Professor of Obstetrics and Gynecology here in 1940. She first set up a consultant gynecological practice in Dundee in 1919, and in the 1920s was an important pioneer of the use of radium at DRI, following a visit to the Curie Clinic in Paris. This is one of the lead-lined containers used to hold Dundee's radium supply. Her other groundbreaking work included vaginal smear cytology for cancer diagnosis and punched card record systems for maternity cases. She was also a talented painter, and we have this rather charming watercolour by her. The establishment of the National Health Service in 1948 had a significant impact on the development of medical treatment and research. At DRI, some landmark work was undertaken by the consultant radiotherapist James Reilly, who set out to investigate the mast cell, whose purpose was then unknown. With the aid of pharmacologist Geoffrey West, he established in 1952 that the mast cell granule was the major source of histamine in the body, making a fundamental contribution to the understanding of inflammatory and allergic reactions. This is some of his original lab equipment, and I particularly love the way this stand for a Bunsen burner has got Christmas wrapping paper on it as insulation. In 1951, the medical school appointed its first full-time professor of medicine, Ian Hill. His work helped to place Dundee at the cutting edge of advances in cardiology. Hill had already done some important work on electrocardiography in the United States, and was the first in Britain to introduce the new unipolar V leads for ECG readings through a highly influential article in The Lancet. And this rather unassuming tangle of wires is actually Hill's original set of leads, the first in the UK, rescued from a dustbin and saved for the museum. At the same time, Dundee also became renowned for its work in orthopaedics. As Professor of Orthopaedic Surgery, Ian Smiley was a world-renowned authority on the surgery of the knee, having previously been based at Bridge of Erne Hospital in Perthshire, where he wrote classic books on injuries of the knee joint and diseases of the knee joint, and designed his own instruments for meniscectomies, which were then used around the world. And this is his original set. And finally, we come to more recent times, and one of the most notable pioneers of today, Sir Alfred Gojira. Professor Gojira arrived at Dundee in 1976 and quickly introduced many new techniques. This circular stapling gun used to connect two separate organs or vessels was designed in the Soviet Union and was brought to Dundee and used by Professor Gojira. But what he's best known for, not just here but throughout the world, is his pioneering work in the development, execution and clinical evaluation of minimal access or keyhole surgery. He established the Surgical Skills Unit at Ninewells in 1992, now called the Gojira Skills Centre, to train the next generation of surgeons, and helped to set up the Institute of Medical Science and Technology, IMSAT, at the Dundee Medipark to develop the next generation of interventional devices and technologies for minimal access surgery and endoscopy. And these are some of the instruments that his team have designed, which have since gone into production. So that's just a quick snapshot of some of the extraordinary medical talent that Dundee's produced over the years, represented through a range of objects and artworks in the Medical History Museum. So I hope you found that interesting, and join me for another film coming soon. Bye for now.